Hi, Michelle Breedlove here, family nurse practitioner student at Clemson University, presenting a case study. I have a 25-year-old female who is Caucasian, and she comes in today with a chief complaint of nasal congestion, headache, sore throat. History of present illness. Patient is a college student and states that her nasal congestion started on the right side approximately 12 days ago, which has progressively moved to both sides. She does complain of a headache, which is worse when bending forward, some nasal drainage, and cough when she lies down, as well as a mild sore throat. She complains of a fever of 100.1 max orally. She states she has taken Sudafed and Mucinex for the nasal congestion, and it is no longer helping. And she has taken ibuprofen 400 milligrams every 8 hours as needed for the headache, and it has moderately helped. Review of systems. Neuro, patient complains of a headache, denies dizziness. HEENT, patient complains of nasal congestion, decreased smell, decreased taste, positive for fever, negative for chills and aches. She denies ear pain, but complains of throat soreness, but denies difficulty swallowing. Respiratory, she denies shortness of breath and only has a mild dry cough, which is worse when she lies down. She denies any GI discomfort or GU symptoms. Past medical history is unremarkable, no surgeries, and only occasional sinusitis noted. Past social history, she denies alcohol, smoking, or illicit drug use and has no significant family history. No known drug allergies. Her current medications are orthotricycline low, which she takes daily for birth control, as well as the Mucinex as needed, which she has taken for the past week, as well as ibuprofen 400 milligrams every 8 hours as needed for pain, and Sudafed she took the first 3 days of this illness, but she states it did not help. Upon physical exam, her temperature is 99.8, heart rate 76, respirations 18, blood pressure is 126/62, her oxygen saturation is 98% en room air. She complains of discomfort at a level of an 8 on a 1 to 10 scale, primarily in her sinuses in the front of her head. Her eyes are unremarkable, no redness or drainage noted. Her ears are unremarkable, positive cone of light, no fluid or effusions noted. Nasal tubernates are swollen and red. There is some slight green drainage visible. Upon illumination of her sinuses, the light is not visible. On examination of her throat, there is some redness and postnasal drainage noted. Negative cervical chain adenopathy. Her tonsils are not swollen. Her heart sounds are normal, S1, S2, no murmur or rub noted. Lung sounds are clear on auscultation. No tactile firmness or consolidation noted upon percussion. Dental health is unremarkable. No dental caries or abscesses are noted. My differential diagnosis is acute sinusitis, upper respiratory tract infection, viral rhinosinusitis. No diagnostic testing is needed given the length of her illness and her symptoms. My treatment plan is that she has sinusitis, and I will treat her with Augmentin 875 BID for 5 to 7 days as per the guidelines. I will recommend that she takes this with a probiotic and with food. She also can continue supportive decongestant therapy with Mucinex D, but can add an oral antihistamine if needed. If these are ineffective, she can try Afrin nasal spray for 3 days max. She also should increase her fluid intake to decrease the mucus production and help it drain. She should also follow up with the office in 48 to 72 hours if her symptoms are not resolving and if her temperature persists or gets worse, or if she has any respiratory distress. Thank you.